Good afternoon, everybody. My name is Barry Hudson. I'm the Director of Public Information for Montgomery County, standing in for Lorna today, who's not able to be with us. So I will try as much as possible to do a good job as she does. Today we have our normal folks who typically join us. We have obviously the County Executive, Marc Elrich, who is here, Dr. Earl Stoddard, as well as Dr. James Bridgers. We're also joined today by Sean O'Donnell from HHS, who leads up our testing and vaccination team. And we're also today joined by Mitra, let me make sure I get it right, Pedumi, who is the director of our office of our Department of Permitting Services, who will be talking a little bit later. So make sure that, as Ohini indicated, that you make sure that you have recording options. In addition to that, if you have questions and you're from a news organization, please put them in the chat and identify the news organization that you're with. So with that said, I think the ground rules are here, and I will now hand it over to the County Executive.
So thank you, and good afternoon, everybody. Thank you for joining us for our weekly press briefing. Today, I'm happy to be joined by Mitra Pedumi, who's the director of our permitting services, to give an update on improvements we've made in the permitting department. I've been talking a lot in the community about these changes and thought it was important to have her here on this briefing. The strides we've made in permitting have not only improved customer service, but they've been critical to our progress in economic development. We've been able to turn things around faster than we've been able to do in the past. And we've gotten actually some pretty positive comments from people over the improvements they've seen in the system. As you know, tomorrow we commemorate Veterans Day. There are Veterans Day ceremonies throughout the county. I'm going to be in Wheaton with the Silver Spring Memorial Post 2562 of the Veterans of Foreign Wars and the American Legion Post 268. And we're going to be joined by Senator Van Hollen and members of the Baltimore Symphony Orchestra. I want to thank the tens of thousands of Montgomery County veterans for their service to our country, and a number of them are also county employees. We're grateful to our military families for their dedication and their sacrifice to support their loved ones who have served. We also know that many of our veterans have suffered. They've dealt with mental health turmoil and post-traumatic stress disorder, as well as a variety of, physical injuries. Over the past 5 years, our homeless services have treated and housed over 200 homeless veterans toward our goal of ending veteran homelessness. However, during the last 20 months of the pandemic, many of our veterans in crisis have had to deal with job loss, increased isolation, substance abuse, and stress. And over the past 3 months, many veterans who served in Afghanistan have suffered increased anxiety and frustration over the images and the outcome of that conflict. We will continue to honor our veterans and their families by ensuring that our county, in concert with the state of Maryland and the U.S. Veterans Administration, provide the support that our veterans need and deserve, from job training and hiring to mental and physical health supports. Veterans should contact and engage with our Montgomery County Commission on Veterans Affairs at montgomerycountymd.gov/veterans. Last night, over 75 people from the community came out to our first ever all Spanish language budget forum. People came with their children and families to participate. I want to thank the county staff and community organizations for making this event a great success. The questions and comments from the attendees were great and helpful. We had translators there who translated questions for me, and they translated my answers back to the community. It really worked out pretty well. This was the first, but this will not be the last. And thanks to the community for coming out and engaging. I heard your issues and concerns. Now on to the usual part of the COVID briefing. We'll start with the case rate. Our COVID update this week, we'll find that our test positivity rate is 1.58%, and we have a case rate of 7.65 per 100,000 residents. We had 96 cases yesterday, including 9 hospitalizations and no deaths. Despite having the best rates in the state, our numbers have plateaued at the break point between substantial and moderate. You see us using a definition of substantial as over 50 cases. And what we found, and this has been going on now for a few weeks, is that we stay right around 50. Sometimes we dip a little under 50, and then sometimes we go over 50. While we had a steady decline in cases that got us to the 50 point, this has kind of been a plateau for a while. So expect to see this. Today, this is the second day where our cases are going to be in the substantial range. They're going to exceed 50 cases. So we did take 7 to go back to a mask mandate. But I just wanted everybody to know that we're kind of standing on this brink between the two rates. The county's indoor mask mandate is currently not in effect in accordance with the county council's regulations. However, I continue to urge everyone to wear masks indoors in publicly accessible areas, particularly regardless of whether you're required to do so or not. This would be different if our cases had continued to plunge and we had gone from 50 to 40 to 30, but that's not what's happening. And so there's little difference between being in moderate or falling into substantial. That means there's still a fair number of cases out there in the community. And we all know about breakthrough cases, and breakthrough cases only happen when you come in contact with somebody who has COVID, most likely somebody who's unvaccinated. So to maximize your health, we are all better off if we continue to wear masks when we're indoors, particularly if we're in a place where there are a lot of other people. And I would say, particularly if you get the opportunity when you're at a restaurant and you're not actually eating. The good news is that even though the mandate is not currently in effect, nearly every Montgomery County establishment I've been in, people are still wearing masks on their own. We have a culture of protecting ourselves and others from the virus. I think our residents learned well from our experience over the last 20 going on 21 months. And they know what it takes to feel safe, and they know what it takes to keep themselves safe. So our vigilance has been a key to the success in this county in our fight against COVID. And I would just encourage everybody to maintain that vigilance. It's really important that we not let this get out of control. We don't want to see a winter spike. It's getting cold. People are going to be doing more indoor activities. You're likely to see the indoors become more crowded. So please do what you know works. Stick with what we've been doing, and we'll all be fine. After 21 months of doing this, I think most of us have realized there's no drastic harm, and we're as free as we were before we had mask mandates. I also want to note how prolific our testing has been, and to thank all those who continue to work on these operations. As you can see from the chart, we've surpassed 350,000 tests just from our Health and Human Services Department. This doesn't include all the tests that are administered by the hospitals, the pharmacies, and the private practitioners. So the county is, administered an enormous percentage of the tests here in the county. It's a good sign for the county that the lull in testing that was in the summer, that since then we've actually seen an increase in our testing rates again. People are getting their booster shots, and our residents still clearly understand that testing for this virus is so important to our own mitigation efforts. Testing is an important component to slow the spread of the virus, and I continue to encourage everyone to test to protect one another. Our vaccine rates, over the past few months, we've been proud of getting around 99% of our eligible population to at least having one dose, and it's been an extraordinary accomplishment. Now the definition of eligible population is changing because we're including the 5 to 11-year-olds, which means you'll see a decrease in our percentages because there's now this larger population that up until last week wasn't vaccinated at all. So the number of people included in this is a larger group, and we are beginning to vaccinate the 5 to 11-year-olds. So while we know this will go down, once it starts at the low point, it'll start going back up again. Currently, 77.9% of the county's total population is fully vaccinated, and 87% has at least one dose. Over the next several weeks, I look forward to seeing our fully vaccinated population grow to being over 80, and we continue to vaccinate more of our 5 to 11-year-old population. And again, this is going to take 2 doses before these folks are fully vaccinated. So we're looking at about, a month between when students get their first vaccination and when they get their second vaccination. So it's going to take a little while to completely climb back up. But just when you look at these numbers, don't dismay. This is just the result of including more people in the population that we're counting. To put this in context, the US rate for fully vaccinated individuals is 58.5%. There's absolutely no reason why there should be nearly a 20-point gap between Montgomery County and the rest of this country. And sadly, if the rest of the country can't make up a bunch of ground on this number, the pandemic is going to remain with us. And, with it, it's going to remain the concern about mutations. We, already are seeing a small number of cases from the latest variant on the Delta. It is of a concern that as this virus mutates, we would like to get it under control before we get a mutation, which could potentially send us back to square one, a mutation that basically can get around the vaccines. The sooner people get vaccinated, the less chance this virus has to mutate. So this isn't just, a vaccination drive. This is a drive to exterminate this virus to the greatest extent possible so that it doesn't have the ability to cause future damage. And this is on all of us to see to it that we can get this done. Our efforts to vaccinate the 5 to 11-year-olds is off to a good start. Since last Thursday afternoon, less than a week ago, County Health and Human Service Department has vaccinated over 9,500 children. This is around 9% of our estimated population of children between 5 and 11. This doesn't count doses from the private sector. As you may know, we started vaccinating the age group days before many of our neighboring jurisdictions. And according to the state's latest numbers, Montgomery County represents over 50% of all 5 to 11 vaccinations given throughout the state. In context, we're about 1/6 of the state's population. So people here are taking it seriously, and it's good to see. This obviously is going to have amazing benefits for the schools, as we'll be further able to reduce the quarantining and the number of kids who are exposed. So I'm excited about where this is heading and look forward to the coming weeks. We've learned from the past and have really integrated our systems both in the public-private sector. So these vaccines are easy and convenient for the recipients to get. This is not occurring by happenstance. Organizing logistics for this additional vaccine rollout has been going on for months, and now we're seeing a result of good planning. But I do want to point out, whether you're trying to use the state system, if you're not using the county and you're using the state system, ImmuneNet still has not figured out how to give people a comprehensive look at the vaccines that are available, a simple portal to enter on and register on, and then pick a site from a variety of different providers. I continue to hear people talk about, and I went on to just experiment myself. We're having similar problems on that system that we had in the spring, where vaccines disappear before a person completes an application, and then they have to go find another site, fill out another application, and start over again. We raised this to the state. It has to be in the very beginning of the vaccines. We told them they needed to fix this. It still hasn't been done. Other jurisdictions have, other states have single points of entry and have done this in a much better way. The state has so much money, it's hard to imagine why we're just not paying to get this fixed rather than sticking with the system, which just causes frustration for people. And I share everybody's frustration when you run into this. Now I'm going to turn this over to Dr. Stoddard and Dr. Bridges for their updates. And after that, I'm going to bring back Mitra, and we're going to talk about economic development, budget, and infrastructure updates.
Good afternoon, everyone. As Mr. Elrich indicated, our data points have plateaued over the past couple of weeks. I know that we've been monitoring the on-ramp and the off-ramp according to the County Council's Board of Health Regulation Amendment. And so Mr. Elrich has recommended and advised us to put a notification or alert system on our data dashboard for the county, a flag/tracker, if you will, so that we can lessen any confusion from the public. We know that our ranges from beginning of the 27th have ranged from 44.83 cases per 100,000 up until today, which is about 53.58. So we want to lessen the confusion, to give folks an indication of where we are, to lessen any questions that we have about our data points. And so that is forthcoming. We're working with our data team. And so I just wanted to share that based on the CE's recommendation in his update this morning to our team. I'd like to turn it over to Mr. O'Donnell before we shift to Dr. Stoddard to give us an update on where we are with our pediatric vaccination strategies, our boosters, and our third shots for those who are immunocompromised.
Thank you, Dr. Bridgers. As the county executive has mentioned, we've had a lot of success moving the vaccine out that has come into the county. In addition to the sites we've done at community vaccination locations, we've also done over the weekend 12 clinics at our Montgomery County Public School System. We've had great partnerships with our school partners and other volunteers who've come out and helped us keep the lines orderly, ensure that we have multiple fluent languages available to communicate with the populations coming out in our county. And we have also worked with our safety net clinical providers in the county to ensure that they have vaccine to assist us in getting to harder to reach populations. We have a number of clinics planned through the rest of this week. We're looking forward to an update from our state partners on the amount of vaccine that will be allocated to us going forward, as well as the time that we'll get that vaccine in. We hope that we'll receive it before Friday, which would allow us to repeat our cadence in getting vaccine out over the weekend. If that does not happen, we'll continue to update our scheduling system so that we can have vaccine available to our community. We have been offering it during the week from 4 to 8 p.m. at our community sites, and again, in concert with our community safety net providers. So we've been working with our PIOs as well to get messages out to the community, and we'll continue to do that to let them know when appointments become available. And we truly appreciate the community's interest in getting vaccinated, and they're coming out in robust numbers to use the vaccine that we've had.
All right, so I have just a few additional comments. So first off, I want to, we recognize that this morning announced FEMA is extending the reimbursement period for the public assistance program through at least April 1st of 2022. It was originally set to be January 1st of the new year, but that extension will obviously allow us to continue to seek federal reimbursement, full 100% federal reimbursement for many of the ongoing activities related to testing, vaccination, and other COVID response related activities. Want to also give a shout out to our Office of Community Partnerships for their advocacy and education around the vaccine distribution. I think it's a particularly important thing that we've emphasized on this call, but also that they've been emphasizing in 7 languages in their messaging, is that the county received approximately 1/3 of the total doses coming to Montgomery County as a whole last week. And while we are very close to having distributed our 13,200 doses through our clinics today, there are many other clinics, opportunities, pharmacies, and other opportunities that we encourage our residents to look at to make sure that we're utilizing every dose that came to Montgomery County, regardless of the source that it came in through. And so while we're often looked at as Department of Health and Human Services as the central place for vaccine distribution, in this case, we received only about 1/3 of the total doses coming to the county. So looking at us exclusively would miss out on a number of opportunities. The last thing I will talk about is, and this got a lot of attention yesterday in our conversations with the county council sitting as the Board of Health. We are having ongoing conversations with the Maryland Department of Health regarding the the quarantining and other guidance provided to schools. We had a very productive meeting with Dr. Chan and Dr. Feldman from Maryland Department of Health this morning. And so I think we'll be working with MCPS around, how we're going to move forward with that. But, as we expressed yesterday, we've had a desire to be consistent with their guidance where reasonable, but also to express how our view of what we think we can safely do in Montgomery County. And I think we're making progress, and we'll probably have something more that we can specifically talk about before the end of the week. So that's sort of where I think we're at, and I think we're ready to take some questions.
I think actually we'll go
Yes.
back to the county executive.
Okay, sorry, my apologies.
No problem.
So I want to thank Dr. Stoddard and Sean O'Donnell and Dr. Bridgers for your presentation. Before we go to your questions, there's been a lot of economic infrastructure, budget, and business news that's very important in Montgomery County. And that's the reason I wanted Mitra to join me today to talk about our progress in county permitting. I was pleased to see that Congress finally passed the $1.75 trillion infrastructure bill. I want to send my thanks to our congressional delegation for their hard work and advocacy to get this passed. Like many, I wish this investment would have been larger for the infrastructure needs that we have as both as a county, a state, and a country. This is significant, but it doesn't get the job done to the extent it really needs to get done. And that's just not a Montgomery County issue. It's an issue throughout the country. Nevertheless, the bill represents real improvements in access to funds for transit and other transportation improvements, and we're looking forward to being able to work with it. Over the summer, when we were debating with the governor over the future of the American Legion Bridge, I-95 and I-270, we asked the state to wait on their overly expensive plan until this federal bill passed to see what we could get for these major transportation projects. There is no reason for just to assume or create a situation where county residents are going to have to pay for this stunningly expensive project when there's major federal funding available to the state of Maryland that we could at least try to tap into in order to make this project more affordable for county residents and frankly residents of the state, because we're not the only people who use this. And the governor's unwillingness to do that is really distressing, because if you're managing limited funds and you have somebody there with money available for the projects you want to build, it at least pays to knock on their door and say, can we use some of these funds over there? But instead, the governor chose to ram through his plan through the Transportation Planning Board and the Board of Public Works, and it's an expensive public-private partnership. It's a bad deal, it's a bad design, and it's the wrong choice for Montgomery County and the region. And now that this infrastructure deal is passed, I hope the state will consider federal investment into this project. I also hope the state will look at the mess they've created. This is, not me speaking, this is the reports that have come out from people who evaluated the situation on I-270. This project, the way it's currently going to be built, is going to make traffic worse going northbound, which is kind of hard to imagine how you could make it worse going northbound in the evening. It doesn't provide the relief that was promised in general, but it's certainly causing a problem in northbound traffic. And this is fixable if they would simply treat this as one integrated project from Frederick to the American Legion Bridge. And if they use the federal money, this could even be a project potentially where it doesn't even require the state to go into a public-private partnership and to use tolls. The state just announced that it has a $2.5 billion budget surplus. It's great news, and it creates a wonderful opportunity for the state to make its own infrastructure investments. A budget surplus is not good for funding ongoing expenses because you can't count on having that money the next year and the year after. But a budget surplus like this is perfect for undertaking some major capital projects. And assistance with our efforts to expand our bus rapid transit system, finishing the Purple Line, are a couple of possible ways to use that surplus. We need a smart and sustainable investments in order to help us fight climate change and its impacts. And I'm hoping that calmer heads will look at this money as a way of addressing unmet needs in the state, rather than figuring out, can I turn this into a tax break for people in the middle of an election year? We don't often get opportunities and have these resources made available. So in my mind, this is an opportunity the state should not pass up. Between that and the federal funds, it's worth another look at what they're doing right now. Good news in Montgomery County. The headline in the Daily Record says, with 18 billion already, Montgomery County businesses on track to a record high investment year. Funding for Montgomery County is on track to outpace last year's numbers by 450%, according to data gathered by the Montgomery County Economic Development Corporation. Over $18 billion has been invested in 76 companies in Montgomery County. And in just 3 quarters of that's just in the first 3 quarters of 2021, as compared to $4 billion that was invested in the county's companies throughout all 4 quarters in 2020. This is a major change and good news for Montgomery County and for Montgomery County companies that we're having a record year with the IPOs and private investments and venture capital. So I'm excited about this. We're working nonstop to make it easier to do business here in Montgomery County. When I was first elected, Councilmember Sidney Katz and I conducted a listening tour with county business owners and residents. We asked them to tell us what was wrong. We knew we were going to hear. And it was important to give people the opportunity to have that conversation with us. And we repeatedly heard concerns about the county's permitting processes. And since then, we've increased the productivity at our Department of Permitting Services, known as DPS. And we did this despite the challenges of the pandemic. I've said this in a number of other cases. The county did not stand still just because the pandemic came in or just because we went to lots and lots of virtual work. We kept looking at what our problems were and trying to address them, even in the middle of the pandemic. So we've improved our customer service by adding new residential online offerings to our website. We're about to launch a new online permitting system that integrates the entire permitting process virtually. This is going to be a game changer. And word is getting out among both the business and commercial industry, business and residential, commercial and residential permit customers, about how much better our system is now. We're looking forward to making continuous improvements. One of the things that we've asked all our departments to do is to adopt an attitude of continuous improvement. You know, things are never good enough. There's never a point when you can say, we've done all we can do, or we're happy with where we are. To the extent we find opportunities to improve things, we're going to continue to do that. DPS recently received an email from a customer that said, you've inspired DPS to work together and to get things done in ways I've never seen in my 35 years of work with the county government. This is the kind of positive feedback we've been hearing, and as DPS continues to improve, we expect more of our residents and businesses will be noticing that we're more open for business than we've ever been before. And I want to thank Mitra and her entire staff in the Department of Permitting Services for their hard work to make these improvements and to serve our public better. I'm just glad she's joining me today, and I'm going to turn this over to her now.
Good afternoon. Thank you, County Executive Elrich, for including me in today's briefing. I am Mitra Peduim, the Director of the Department of Permitting Services. I'm excited to be here to share with you the great things happening at DPS. For those who haven't met me, I started back in April of 2020 during the start of the COVID-19 pandemic. Our operations have continued nonstop throughout the pandemic. We transitioned our business processes and staff quickly, shifting all office-based staff to telework to ensure continuity of our operations. I'm proud of our dedicated employees who have shown flexibility and readiness to provide our customers the services they needed during the health crisis, including online permits, plan reviews, and virtual field inspections where possible. Our inspectors have been in the field throughout the pandemic. They have worked at construction sites throughout the county to ensure projects were completed on time, and so that occupancies could be granted. As you know, construction and home inspections did not slow stop during the pandemic. In fact, they increased overall. With more people working at home and engineers and architects at work with no vacation, we saw an increased demand for construction projects and permits. DPS staff and inspectors were also an essential part of Streetery's opening. They expedited permits for local businesses for outdoor tents. We never stopped serving our customers. In fact, we increased and opened our pre-design consultations to all and whoever that could benefit from this service. DPS work is critical to local and regional economy. I consider DPS the economic engine for the county, and we know how important it is to keep projects moving on time. If you would please have the PowerPoint to slide 2. During the first 90 days, I met with DPS employees, many stakeholders, and the business community to create a vision to keep improving and getting better at meeting our customers' expectations and needs. As a result of these meetings and the full business outreach, I concentrated my action plans in 2 pillars. One is focused on providing an excellent customer experience, and the other is streamlining the permitting process. Could you go to next slide, please? We have reorganized, restructured, and modified our business processes and practices within DPS to create a customer support and outreach division using our existing resources and by moving more than 75 staff within the department. This new division is a centralized point of entry for all applicants, and our new division is responsible for the administration of all permits and service requests. The goal is to have a point of contact for all projects and be able to respond faster to customers than ever. This proven to be working as we're receiving fewer complaints and customers have noted our commitment and flexibility. By summer of next year, we will launch a new permitting system to streamline the permitting process for our customers. This enterprise cloud-based system will be a game changer for the county as it will transform the permitting process within and outside the department. For the first time in the history of DPS, all permits will be online. Currently, we are in the processes of moving data from our 4 existing platforms to cloud. The result will be 99% uptime. And by moving from multiple legacy systems to a state-of-the-art comprehensive system, DPS is positioned to make constant and steady improvements in its business processes and service delivery to our customers. In addition to efficiency and streamlining the processes within DPS, we are expecting to save about $2 to $3 million in operation costs within the 5 years of the new system rollout. Could you please go to next slide? Finally, we have a new home at Wheaton Office Building, located at 2425 Reedy Drive. Our customer service office is on the 7th floor for walking customers, and we have been open since mid-June at this location. Please stop by and see us. And thank you, County Executive, for giving me this chance to highlight our accomplishments and to preview what is yet to come. It is a very exciting time at DPS. Thank you.
Okay, thank you very much to all our speakers. Now we will open the floor up to questions. And our first question comes from Kate Ryan from WTOP. Kate?
Hey, thank you very much. I hope you can hear me. I Had a question about the school system test to stay. And again, Dr. Stoddard, you mentioned you had discussions with state officials and education officials, I'm assuming MSDE today. Can you again give us an update of when will that test to stay program then go into effect and what will change from the original plan?
So we still have to talk. So we did talk to the Maryland Department of Health. We did not talk with the Maryland State Department of Education because I think largely the feedback was a health specific feedback. And so I think that we're going to talk later, hopefully later today, or certainly, before the end of the week with the MCPS to talk about how we proceed with the guidance that we were given with the Maryland Department of Health. They seem generally open with our idea of doing a pilot of test to stay and utilizing, providing the data to the state on how we can proceed, but we want to talk it over with MCPS to make sure that we can collect the data that the state has asked us to collect as part of this process. So I would guess we're talking probably early next week for something more. I think we'll be able to talk more about it by the end of this week, though.
Got it. And meanwhile, the school has its own quarantine policy. How does that stack up? And do you feel right now that's as effective as it needs to be?
So I think the point that we were trying to get to is that, I think if you look at the numbers, certainly even I think there's 273 quarantines for the beginning first week of November. If you pace that out, that would be, another reduction over what October was. We saw October was already a 60% reduction. So we think we can get better and better at this as we move forward. And that's the point that we're trying to get to with this test to stay. So what we've done already is if you have a masked exposure and that student is enrolled in the weekly screening testing or is willing to enroll at the point of their exposure, then we'll allow that student to stay with MCPS in the classroom and continue to stay in school as long as they remain asymptomatic. So then the only situations we're really trying to focus on is really the lunchroom exposures, which are about half of the exposures that we were seeing in October were probably also carried over into the lunch period. So we think the changes we've already made will significantly reduce the quarantines, but also we'd like to be able to include at least the lunchroom exposures as part of that test to stay program, which would just further reduce further and further. We're trying to layer on top of the other these protective measures to allow us to keep more and more students in school. And we're hopeful that we'll be able to do that with test to stay. So when the guidance was released from the state, we in the original provision of test to stay, we were going to do a broader swath that included masked and unmasked exposures. When the state guidance came out, we said, we can narrow down to just unmasked exposures because the masked ones won't have to quarantine already. But when the state provided its additional feedback last week, we kind of paused on that because we needed to make sure that what we were going to do was going to work for them. And so that's what we've been doing in the interim with the MDH and other partners. So.
Got it. Appreciate that. And one question for Mr. Elrich. Yesterday, Board of Education announced with just 2 weeks to go that the day before Thanksgiving would be a day off because they don't have enough substitutes to handle the demand. And you had teachers saying, we need help. We are crushed underneath the weight of our duties with COVID piled on top of that. And former lawmakers from Annapolis joined them as well. Your thoughts on what needs to be done to support the schools in tackling and handling COVID, and also the substitute shortage? Is there any way to make inroads? I know other counties have the same problems.
This whole country has the same problem. I mean, there's a real problem with finding teachers, finding nurses, finding bus drivers, health techs, you name it. I was in a hospital the other day talking to them about their nurse situation. It is so bad that they're paying nurses $10,000 a week. Do the math. Because that's the only way they can get contract nurses. And that's demoralizing to the rest of the staff there that wonders why they're working for just the contracts they signed. So this is going to take a while. I mean, number one, we've kind of neglected training the workforce that we need. Teacher shortages have been creeping up for a number of years, and I think COVID certainly accelerated people leaving the workforce. We read these articles about the great retirement. I think there are impacts from that, and people aren't willing to put themselves at risk in environments that are closed, because as safe as we try to make it, coming indoors certainly bears risks. We don't have the ability to make it 100% perfect and flawless when there are situations, even in schools, where masks are off. These all provide challenges. And then, of course, this kind of falls on the teachers, because they're the bodies that are in the school that then get pressed into services that normally might be done by other school staff, but they're not there. And so I hate to prescribe for the schools. If I have thoughts on this, what I would just say is, with limited amount of time, one might think about prioritizing what one teaches in order to ensure that the students get what they need, and the teachers get the time they need to actually prepare for the work. I mean, if teachers are losing their time during the day, then all the prep work that a teacher would do, remember, I was a teacher, the prep work you would do during the day winds up work you're doing at home. So it's being done at a time when no one's paying you for doing that work, because they've taken away your paid time during the day. I do think they've got to figure out a solution. I'm not sure money is solely the problem. If a person's worn out and stressed, money does not reduce being worn out and stressed. It may require some adjustment of how they do the load during the day. But I think it would be helpful if schools and the teachers sat down and said, this is the problem, let's talk about what we might do to get to the problem. I think this is one of those perfect examples where it shouldn't just be left to management to prescribe solutions and hope they work, but this is an opportunity to bring in the people who are most impacted and give them a role in deciding how can we all get through this together. The teachers want to teach, and the teachers want to teach successfully. So it's not like we have an unwilling group of workers who don't want to do this job, but they're going to need help. And I hope everybody can find a way to talk with each other and get to some solutions.
Got it. And I appreciate that. I know there are two more behind me. Just a quick follow-up. Which hospital is paying $10,000 a week to nurses? And are these critical care nurses?
Not going to say it, but I think it's anybody who's hiring contract nurses.
Thank you.
I think they're called, I think we refer to them as traveling nurses. A teacher, I mean, some nurses apparently have taken to being mobile and going where the most dollars are.
Got it. All right. Thank you so much.
Okay, Dominique just withdrew her question. So Stephanie from Fox 5, your questions I think you have for the county executive.
Yes, thank you. So I'd like to talk about school violence here. County executive, yesterday we had reported that according to police, they have already responded to at least 48 assaults in the county's high schools all across the county. And this is compared to throughout the entire school year of 2018-2019. So about 3 years ago, 51 assaults or attacks. So we're already close to that number in the first quarter. Looking at the overall violence and given your recent comments on the Blair High School stabbing and SROs, do you then believe that MCPS has not been impacted by the removal of school resource officers this year?
You're conflating two different things. I mean, what's happening with violence and youth violence is happening again all over the country. It's happening in places that have SROs. It's happening in places that don't have SROs. Kids are struggling to come back. At least a lot of the kids are struggling to come back. And, we were kind of forewarned of the psychological damage that would be done to these kids by having the last, year of chaos that we had last year, which is not the school system's fault or anybody else's fault, other than the COVID fault. Our officers are responding, which is what we wanted them to do. We've placed officers in positions where they're able to respond and they're not tied up with other responsibilities. I expect that to continue. The school system, when they have particular cases that they're concerned about or situations they're concerned about, they're allowed to call officers in and engage with the officers differently. And some of the schools are actually doing that. So we think this is flexible enough to meet the needs as they evolve in different schools around the county. I wish there was a way to talk to these kids and get this to chill out, but it's not good. It's, you know, it's not good here, and it's not good in a lot of places. And
Now, to respond to that, I know a lot of parents who don't care about what's going on in a lot of places. They care
Yeah.
about what's happening in their school community.
it's not clear that the police would, that having an officer in the school would have prevented any of these.
Correct, but you had mentioned that, you know, the school system was forewarned. So there are parents who believe that the SRO was a position of support for the school system and are upset that they were removed before the support systems that were supposed to be entered into the school were actually put in place. Can you confirm, as of today, I know there were different numbers of positions that were supposed to provide for mental health support, emotional support for these students. How many have been filled and are now working in the school system?
I don't know. She had upped her number from the 25 that was proposed by myself and by the council members. She's upped her number to 50. And they're trying to hire and bring these people in. And we're working with them to see that they get hired, but I don't know what the number is today.
And then another question for you. So the Seneca Valley principal is calling for all dads to help monitor students during key times. What would you say to parents who might see this as an example that MCPS cannot keep its students safe?
It sounds like you're describing a situation, if they're asking all dads to do that, it's something that's bigger than any one SRO would do to keep the students safe either. I mean, when you look at some of these incidents, there's no way an SRO would have been where they were needed to be at the point that an incident occurred. So it may not be a bad idea to try to get parents to engage more in the schools when they're available, but I don't know why the principal would call for all dads. I think it would be just as appropriate to ask more parents, regardless of gender, if they have the opportunity to help out and be more present in the schools. I just said, I don't believe for a second that putting one officer in a school is going to solve the problem. And I will say officers are not therapists. And if we're dealing with kids who are have been deeply affected by what's gone on over the last 21 months, it's really the mental health supports. I mean, officers have zero training in real mental health support. We give them some very quick training, which may be useful, but it's not the same as bringing professionals into the school.
So going back to the fact then that the school system started without the mental health support it needed in place, did school leaders, did county leaders overall put the cart before the horse here then?
I guess my belief was they were hiring. I was told that they were hiring. So I'm not sure where they are in their hiring right now, like I said. But I do know that they actually expanded the resources, and they actually have a 2-year plan to go beyond SROs into a full services of mental health services available in the schools we never had before. So I think the school system's taking this seriously, and I'm sure they're also dealing with how fast they can hire everybody they need.
Thank you.
Thank you. Our next question is from questions are from Steve from Bethesda Beat.
Afternoon, everybody. Kind of going back to what I've written about a lot lately, the mask mandate. And I know obviously the Board of Health's recent action puts in kind of a clause that once we hit 85% of the county being fully vaccinated, you know, the order's terminated. Given the efforts of vaccinating 5 to 11-year-olds, and any of the health officials can answer this, do you think, just given the demand you're seeing, that in the next month or two, once the young ones come in back for their second shot, that we're going to hit that 85% kind of benchmark?
I don't think there's any. Oh, go ahead, Dr.
No, go ahead, Dr. Stoddard.
I don't think there's any question.
We're going to say the same thing.
Yeah, I don't think there's any question we're going to hit the number.
Right.
It's the question of when we hit the number.
Right.
And that will be largely dependent on how quickly we get doses. Because obviously, as we illustrated, I think I tweeted earlier today, we have 480 doses left at the HHS level. So, and we haven't scheduled clinics for tomorrow because we need to know how many doses we're going to have to distribute tomorrow. And so the pace at which we get to the number that we're all looking to get to will depend in large part on how quickly the federal government provides to the state and the state provides to the county the necessary number of doses. As we're showing with the clinics now, and also just the general demand among parents, I don't think there's any question that we have what amounts to 75% of our parents wanting to get their 5 through 11-year-olds vaccinated. In addition to the fact, we've already seen anecdotally that kids being vaccinated is encouraging some older, adolescents, young people, and parents to come in with their children to get vaccinated as well. And so I think we're gonna. I have every confidence we're going to get there. We've gotten there in every other category, and I don't see how this category is different. It's just a matter of how fast we get there based on the doses that are provided to us.
A simple question that's interesting. What about young kids stepping forward is encouraging other age groups to kind of take the plunge now months later?
Sure, Steve. So I'll give you a perfect example. Not only the other age group for our 12 plus population, but for our senior population. Dr. Kroll, the director of Health and Human Services, and I had a conversation over the weekend, and he attended one of the sites. So he actually saw and witnessed a senior, a member of our community, actually get her first series of the vaccination, of her vaccination series, because she saw and she was encouraged by the 5 to 11-year-olds. So it's across all of the age cohorts where we're seeing folks getting their initial series or their boosters, or even our pediatric vaccinations. One of the strategies that we did in order to do this was to have not only our initial series, but our boosters and third shots for our immunocompromised population, as well as those pediatric vaccines available, so that as families come in, they could actually, if they needed to get a shot, they would get a shot as well as their children.
And I know that you said you're still waiting on the number of doses from the state later this week. Do you have any sense of that? It's going to be, I think it was 3,200 this first go around. Is it going to be more than that, around the same amount? Any idea yet?
None as of this morning. As Dr. Stoddard and I had a conversation with the Maryland Department of Health, I specifically asked that question and didn't get a number. So we are anticipating and waiting for those doses to be delivered. As Dr. Stoddard indicated, we are holding and trying to schedule our appointments based on the number of doses that we receive under wave 2 allocation.
Steve, I believe we got a lot more than 3,200 doses.
I said 13,200. Sorry, I misspoke around that. But yeah, yes, correct. Right. Thank you.
And that's just our doses. That's not the doses that went in to the rest of the health system.
Correct.
So
correct.
We are not the only people vaccinating children.
That's right. No, thank you, everyone. That's all I had. Thank you.
All right. I don't see any more questions in the chat. Any other questions from reporters? Going once, going twice, going 3 times. I held that one slow just in case there was one more. I did want to, I know County Executive, you were talking about Veterans Day, and you did mention, I think before we jumped on, about the Marine Corps and their birthday today.
Oh, I forgot the number. Was it 246th?
Yes.
Ah, my memory is better than I thought. It is the 246th birthday of the Marine Corps, November 10th. And what if I deduct 246, where do I wind up? 1775. Is that right?
You're the math. You were the math teacher, so.
I'm trying to picture these numbers in my head, but it's a long time ago. 200 years would be 1821, and they knock off another 45 off that, or 46 off that. Long time ago. None of us were in that first group.
That's right. Okay, so since there are no more questions, thank you all for joining us today. Make sure you thank the veterans that you know in your life or around for their service tomorrow. Certainly, if you have the time, you can join the county executive in Wheaton for that particular ceremony and any other ceremonies that are around. I know we have at least right here below me on the screen, Dr. Bridges is a person who served, and he's here. So thank you for your service. And I believe our technical person in the background, Oheni, is also a veteran. So thank both of them for making this particular piece work for us today. So thank you everyone for joining us today, and have a safe and pleasant Veterans Day tomorrow. And we'll see you next week.
Thank you.
Thank you.
Thank you.